Welcome to CarePod, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kiplee Bell, as she interviews different experts along the caregiving journey.
Okay, so I'm so excited to have a guest shed some light on optics. This is the CEO and founder of a company, a healthcare education company called Optics, David Brake. Thank you for joining me today here on the CarePod.
Kiplee, it's great to be with you.
Yes.
Thank you.
So I did a little bit of digging and trying to educate myself. And, honestly, first of all, I was really excited because I'm big on medical education. I love to educate both a new and old entree into the medical profession, all clinicians of all stages, and saw your background, your extensive background in medical education. But particularly, tell me about optics and what you're hoping to accomplish with the company. Very curious.
Well, on one level, Optics is an AI forward or AI first company. And I'm always careful to say that because these days everything has AI in it. But it's really more important to talk about what it does. We use an AI technology to help mitigate risk and ensure the safety of healthcare workers. So what it does is very important. A lot of people do not realize that healthcare is the number one employer in this country today. In fact, in 40 of the 50 states, it is the number one employer. They also don't realize that healthcare workers are 5 times more likely than the average worker to experience some form of violence while on the job. It is a tough job at times, and it's something that people are just beginning to recognize, state legislatures, the federal government. But to be a healthcare worker today, it's not always easy. And we have a program that really is designed to address the safety and well-being needs of healthcare workers.
I found that to be so tremendous because in my earlier career in emergency medicine, we would, take these modules about de-escalating a potentially serious violent episode, aggression towards ourselves or between colleagues from a patient, et cetera. But I found it so alarming, the statistics that were listed on your website, that it's so commonplace. So we ask our guests their why. How'd you kind of entree into this? Felt like a niche, right? But then to hear you say, no, this is widespread and it's common. And because healthcare is one of the largest employers across the country, it's an area that needs increased attention.
Well, Kiplee, this is something that has economic cost factors that impacts healthcare organizations. So in addition to keeping people safe, it's actually a $12.7 billion problem annually to the healthcare industry. And many people think that that's actually underreported because a lot of workers do not report instances. There are situations where they feel that it's just an on-the-job hazard. Sometimes they feel that they'll be criticized or penalized for reporting certain situations. So we do know that it's underreported. You know, numbers and statistics are one thing, but there's a personal story behind all of these statistics. And you may have seen this on the website, but if you think about a typical day, like the sun rose here today at, I think it was 6:57 a.m. Between the time that the sun rose and it sets tonight shortly after 6, here's what's going to happen in healthcare. There will be over 2,000 nurses and nursing assistants, frontline personnel who will leave the business. There will be 80 healthcare workers who are going to take time off because of violence-related injuries. There'll be 240 nurses specifically who will leave, and there'll be 46,000 patients who will experience some kind of care delay or service that they consider unsatisfactory. And that doesn't even begin to touch the workers' compensation claims, the liability insurance claims, the litigation. But for every one of these statistics, there's a real person. And it could be a neighbor, a family member, somebody we know who is dealing with this situation.
So how is the AI forward platform equipping the employer to be human focused and empathetic in this regard, in the protection of the employee and in reduction of the cost liability from the employer's end? How is AI equipping and creating a win-win situation?
Well, I like to tell people that it's a little bit like having a crystal ball where you can look forward and see where possible things that you're doing in your current practice could create problems. So if you think about healthcare, it's a highly regulated industry. They have to comply with different state laws, federal laws, different agencies. If you're a nurse, it would be the Joint Commission. There's OSHA as well. And staying on top of all of those laws is very, very important. What we do with optics is the first part of it is really what we call a current state assessment. Now, there are about 500 questions, and this is using agentic AI. So the agent will walk you through the questions. So if you're a large hospital facility, you might have five, six, 10 people from your organization responding to these questions. And what it does is it creates a current state report. So you know where you're at vis-a-vis regulations, compliance, best practices, and it gives you a score. It then gives you an electronic dashboard, and that dashboard can be customized, but the dashboard will show you essentially where you're at, and it will produce an action plan, if you will, that will help you go from your current state to, I don't want to call it an aspirational state, but where you should be in order to be compliant, providing for a safe and secure environment for your employees and your patients. And in essence, it's not rocket science, but it's not something that a lot of healthcare organizations are doing. And it's something that many of them do not do well because really up until COVID, it was not a top priority. No one is ever going to say that, well, we don't care about the health and wellness of our workers. But in survey after survey, up until 2020, healthcare executives would list healthcare safety, worker safety, as maybe number five or six on their top 10 list of priorities. Not surprisingly, financial operations were generally number one. COVID changed that. And I think it's because a lot of the C-suite began to realize that there's an economic cost factor with us not making sure that employees are safe and cared for. And if we can address that, we can impact some of the other costs. So since 2022, worker safety has been number one or number two on that list of top 10 top of mind things that executives think about.
Very, very interesting. So, does the platform stratify areas of healthcare, divisions of medicine that are higher risk? So, if I were a betting woman or based on my own experiences, it would be psych and emergency medicine, with a close third of, the dementia spaces because of sundowning, et cetera. So does the platform stratify accordingly or triage, I guess, divisions of medicine that are more at risk?
It does. And as you look at the healthcare market overall, obviously you've got hospitals. There are 6,100 hospitals in this country. Some of them are part of, large conglomerates. There are assisted living centers, skilled nursing centers. The range goes on. There are private physician practice groups. Some of those have got 500 to 1,000 employees. So what the system will do is identify very early what state you're in, what regulatory agencies you need to comply with, what service lines you may have within your particular organization, and then it will pull up the questions that are more specific to that. So the report that I told you that you get this gap analysis dashboard with recommendations is very specific to your department, your area of practice, your location, and regulatory agencies that you need to comply with. So if you're a large organization, there could be 10 different service lines or areas represented. If you are a smaller assisted living center, it would be a bit narrower. But by the way, assisted living actually they have higher incidences of workplace violence
Oh
than
yeah.
even hospitals.
Yeah, that doesn't surprise me. Just because of the injured brain and the fragility of, a person sundowning, not feeling in their own environment, wanting to be controlling and, you
Yeah.
know, misplacing those emotion and that aggression onto staff. So absolutely.
What if your next breakthrough didn't come from pushing harder, but from pausing long enough to remember who you are? This November, we invite you to heal, fill, pour. An intentional space for leaders, clinicians, and caregivers to breathe, reflect, and align. Come rest on purpose.
So, what is the safety in the safety? So, how does that employee now have a safe space to be able to report within this platform, per se?
Well, part of what you're talking about is a culture change. And I wish I could say that AI could change the culture of a healthcare organization, but we know that it can't. But the first step in changing the culture is creating an awareness and creating a collaborative relationship with your stakeholders. And we believe by having some of those stakeholders involved in doing the assessment on the front end, they're actually participating in coming up with, their current state analysis, if you will. But then we hope that they will be able to participate in implementing some of those solutions. Most larger hospitals have workplace violence prevention committees in place. Some of them only meet once a year, some of them meet monthly. But we hope that this is a tool that by not only increasing the awareness of the problem, but by suggesting some solutions and providing a framework for that, and doing that with the stakeholders involved, that it will have an actual impact on the safety and the wellness of the healthcare professional.
Absolutely. Because obviously, in this current climate, the heightened emotions and disagreements that arise from even the most futile of conversations can escalate, etc. So it's really important work. So why, tell me why, your personal entree and mission and interest in this area?
Well, from the beginning of my career, I have been involved in healthcare publishing and education. And I have to say that that publishing background certainly gave me an interest and a focus on this. But beyond that, I would say personal experience that I've had with the healthcare system, with people who've been close to me, family members, and understanding when you're in a hospital as either a patient or as someone close to that patient, all of the technology in the world that they may employ to treat your disease condition, as wonderful as that is, it doesn't replace the smile, the attentive nature of the healthcare worker, whether that's the physician or a nurse or a CNA who's right there at your bedside. And if you think about all of those people, they've got lives, they've got challenges, they've got things going on at home, they've got kids who are misbehaving and all kinds of things happening in their lives. And you don't just check that at the door, you bring that to work. And when they bring that to work, and that's combined with somebody who, I'll use an example from assisted living. I was talking to a executive director of an assisted living facility just last week, and he was saying oftentimes it's the family members of the patients who are creating the problem. They come in and they don't have a full context of what's going on, but they see that, well, mom is complaining and she tells me that she's been left alone for 8 hours. What's happening here? How come you people aren't, doing your job? Those kinds of conversations have to be de-escalated because oftentimes they're not factual. It may be mom's perception that she's been left alone for 8 hours. Or maybe even if mom has been left alone for 8 hours, there are different ways that you need to have those conversations to de-escalate and realize that the healthcare facility, whoever they are, they're generally there because they care about people and they want to service those people. Now, that may not describe 100% of people who go into healthcare, but I honestly believe, based upon my experience, the vast majority of people who choose healthcare as a way to make a living do it in part because they care about people and they want to help. And so we're hoping that Optics for Healthcare facilitates that
That conversation.
that conversation of what's inside of them, the reason that they came into the profession in the first place.
Yeah, that is so clutch, and it's so refreshing to hear that, spits back at me, for lack of a better word, in that, you know, there is this concept that those in the medical climate are not human, you know, that we have to eat and, take a breath, and that, what you said about bringing your own baggage, if you will, good,
Mhm.
bad, or indifferent, on a good, bad, or indifferent day into that workspace, and then that colliding with an incident that may cause a violent event. So that's just so clutch. It really, really is. I remember years ago, I had an attending in my, like, one of my first early rotations, and he said, when this ER door opens, everything that's going on in your life is a closed book for the day, in terms of putting that, compartmentalizing those areas of your life so that you can focus on the patient. But, what you're saying in optics, which is brilliant, is to say, hey, let's train your best of best to understand how to manage that all in the context of proper behaviors and protocols and interpersonal communication and interaction with others. Amazing. That's
At the
really good.
on the front line, that's absolutely it. From the C-suite perspective, we hope that it gives them information to increase what we call decision velocity. If you can't, I learned long ago in business that if you can't measure it, you can't manage it. And so we're trying to give them meaningful data points that allow them to increase their decision velocity. So if they're not compliant in a particular area, or they need to add wearable panic buttons or cameras here or there, it shouldn't be something that they think about for 6 to 12 months before they act upon. So we hope that it increases the decision velocity.
That is so good. That's so good. If you can't measure it, you can't manage it. Wow. So tell me, how are you coming in then to an organization after you have your data points, you identify areas of need and pain points, if you will, of the staff? How are you training those individuals? You're empowering now your C-suite folks, but then that has to trickle down. So how are you empowering the staff? Or training the trainer, if you will, in the optics model?
That's a great question. And it's important to note that we are in the early phases of bringing this out. And we are following, people in the computer field will recognize agile programming, but we are following a very agile, iterative process with the people that we're working with. So we have pilot programs set up with almost 100 different programs across the country. And as we roll out the program, we're literally screen by screen, feature by feature, gathering feedback from people on the front line. Because we know that, hey, the CEO might think, hey, this is great. It's going to save us money. People are going to be safe. They're going to be happy. But we also know that for the healthcare worker, it could represent, oh no, one more thing that I have to add to my list that I need to do. So ultimately, it needs to save them time, and it needs to be something that I won't say it's fun to interact with, but they understand how to use it and they can interact with it in a way that the ergonomics, the design, the feel, the flow of the program is something that not only they can use, but they do use. That's the key to making it sticky. So that attention to those people who are doing the assessment or creating the outputs, that's an important part of our training. I will mention that we've partnered with Arizona State University's College of Nursing and Healthcare Innovation, and they have been just tremendous. They have assigned some of their graduate students who are doing some background work for us. We've got an advisory panel with just some tremendous people who have a deep background in this area. So all of the recommendations that we have and the reports that are generated come from credible sources. It's evidence-based. And as you know, that's very important in healthcare.
Yeah.
When you say evidence-based, okay, if you can say this is evidence-based, that's a winning statement generally.
So tell me, any international work in this regard?
Not yet. We have looked at the European Union, we've looked at the UK, India. This is an international problem. And our very beginning, our MVP, as they say, our minimally viable product is for the US and it's specifically for healthcare. But I have had people from India, the UK, the European Union who have seen an early version of this who've said, we really would like to talk to you about how it can work there. We know that we need to get it right for one specific segment of our market, if you will, before we expand. And by the way, one of those areas that we would like to expand into is education, particularly K-12 education. Can I just give you a 60-second overview of what the
Sure, yeah.
problems are there? There is a mental health crisis going on right now in K-12. And it's something that not everyone is aware of unless you are a teacher or a staff member at a school district and you see mental health issues, behavioral problems. It creates attendance problems. It creates problems for the learning environment. It can impact test scores. And as importantly, it can impact the well-being of teachers. There's a mass exodus of teachers from the field right now. And a lot of it is just because of everything that they have to deal with in the classroom that when I was in school, these were not things that teachers had to do, but they have to do these things now. So we've actually done a little market acceptance test in education, and we believe some of the same things we're doing in healthcare could apply to education. So I let the cat out of the bag. That would be our next area of focus.
Incredible. Well, I applaud your work. Tell us, we are an international CarePod audience. Tell us how a firm, a teaching institution, a medical healthcare, entity can get in touch, collaborate, et cetera, with you all.
Well, the best thing to do is to go to our website, and I'm sure you'll probably post it on this podcast. But it's www.optics, OPTICS, for healthcare.com. So optics.com. And you can certainly request more information. And if you post my email address, one of the things that is so important to me are having these conversations with healthcare executives, frontline workers. I am in an information gathering mode about their experience and basically testing assumptions that we have and hearing their stories. I'll say it's one of my favorite parts of the job, but it also can be emotionally taxing because of some of the stories that we do hear from people. But nevertheless, hearing more of those stories are important. So I'd love to hear your story. And if you think that you might be right for a pilot of optics, certainly we'd love to have a conversation.
Amazing, amazing. So give us our parting words as we land the plane here.
Well, I think that if you look at where we're at today in our society, there just seem to be greater levels of incivility, maybe less compassion. I still believe in the good nature of most people deep down inside, even people who can be difficult. I think there's a burning flame, a light, there's a goodness. And I think that given the choice, most people will choose good over evil. That may be a very naive assumption, but it's one of the ways that I lead my life. And relative to optics and the work that I do, I've had some people say, oh, this is a great idea. The business is going to boom, which we certainly hope it does. But I've always tried to look at my life in terms of doing well, meaning the numbers, by doing good. And if we're doing something that is not doing good, I really lose my interest.
Yeah. It's all about transparent leadership and authenticity. Absolutely. Well, thank you so much for being my guest.
Kiplee, thank you. It's great to spend some time with you.
Yes.
Great information right from the source. For more information on how to caregive like a boss, check out impactfulcaregiving.com. Want to be a guest on the show? Contact us at CarePod at impactfulcaregiving.com.